Stop what you are doing. Look down at your feet right now. Because what I am about to tell you has already sent over 150,000 Americans into a surgeon's office. Not because they ignored a diagnosis, but because they never knew there was anything to diagnose. These people walked into a doctor's office for a routine checkup. They left with a referral to a vascular surgeon. Some left with an amputation scheduled. And in nearly every case, every single case, their feet had been warning them for 2, 3, sometimes 5 years before that appointment. Not in a way that required a blood test. Not in a way that required a specialist. In a way they could have seen with their own eyes in 30 seconds every night before bed. Nobody told them what to look for. I want you to understand something before we go any further. The image that comes to mind when most people hear the word diabetes is a dramatic one. A needle, a glucose monitor, a hospital bed. What nobody talks about is the decade that comes before that image. The decade of quiet, ordinary-looking changes that a body tries and fails to communicate because the person it belongs to was never taught how to listen. That decade is happening in millions of people right now. It may be happening in you. I am Dr. Ethan Reed. I have practiced integrative medicine for over 2 decades, working almost exclusively with adults over 60. This channel exists for one reason: to give you the conversation your doctor does not have time to have with you, the kind that explains what your body is already doing before a diagnosis forces the issue. If that is the kind of medicine you believe people deserve access to, I would ask you to subscribe before we go any further. We are on a journey to 100,000 subscribers, people who have decided that real, evidence-based health information should not require a copay to access. Subscribing takes 3 seconds, it costs nothing, and it is the clearest signal you can send that this work should keep being made. The button is right there. I will be here when you get back. The conversation I have most often, and most grieve not having sooner, is the one where I sit across from a patient and walk them through the signs that had been visible on their feet for years before anyone decoded them. I have had that conversation after an amputation. I have had it after a stroke. I have had it on a better day, in time. I want to have it with you today, in time. There are 9 signs on this list. I want you to stay through all of them because reason 1 is the one I need you to take seriously. Not as a possibility, but as something that may already be in motion on your body right now. It begins as something that looks so minor, most people never mention it to a physician. It can end with the loss of a limb. And once you understand the mechanism, once you understand exactly why a small foot wound becomes that, you will never look at a minor cut the same way again. Let us go through all 9, starting at the mildest warning signal and working toward the one that carries the highest stakes. Stay with me. Here is what is happening inside your body when blood sugar stays elevated for months or years at a time. Your circulatory and nervous systems depend on a clean, steady supply of oxygenated blood reaching every corner of your body, including your feet, which sit at the farthest end of the longest delivery route your heart manages. When glucose builds up chronically in the bloodstream, it begins attacking 2 systems simultaneously: the protective myelin sheath wrapped around your peripheral nerves and the walls of the small blood vessels that carry oxygen to your tissue. Nerves start misfiring, vessels start narrowing and stiffening, oxygen delivery to the feet slows, communication between your brain and your extremities becomes unreliable. And here is the part that should make you pause. This process does not announce itself. It does not begin with pain. It does not begin with numbers on a lab report. It begins with the exact 9 signs I am about to describe. Signs that look, to the untrained eye, like the ordinary inconveniences of aging. They are not inconveniences. They are the first chapters of a story that ends very badly for a significant number of people who are watching videos exactly like this one and hoping someone will finally explain what is happening to them. This is not inevitable. This is physiology, and physiology can be changed.
but only if you know what you are looking at. Reason 9, tingling or numbness, that appears without a clear cause. Most people have felt a foot fall asleep after sitting in the wrong position. That is entirely normal. Here's what nobody tells you. When that same sensation begins appearing regularly, without any positional explanation, it is crossed into a different category entirely. When chronic high blood sugar gradually erodes the myelin sheath, the protective coating around your peripheral nerves, the electrical signals traveling between your brain and your feet begin to distort. The nerve still functions, but not cleanly. The result is that familiar tingling sensation, except now it is happening because the nerve itself is compromised, not because your leg was folded too long. A landmark study published in Diabetes Care found that peripheral neuropathy is the single most prevalent complication of type 2 diabetes, present in nearly half of all patients. And in the majority of those cases, tingling in the feet was the first reported symptom. A 71-year-old woman came to see me after her husband noticed she had been rubbing her feet every night before bed. She had been doing it for over a year. She called it restless feet. Her fasting glucose came back at 196. She had been in an elevated range for at least 2 years without knowing it. The tingling was a message that had been sent. It had just never been decoded. The fix: a 20 to 30-minute purposeful walk every single day. Not a stroll, a walk that gets your circulation moving all the way into your peripheral nerve tissue. Movement is the most direct, accessible tool you have for supporting nerve health in the feet. Pro tip: walk on flat, even surfaces in well-fitted shoes. Any irregularity underfoot becomes a meaningful risk when nerve sensitivity in the feet is already compromised. Reason 8, burning in the soles of the feet, especially at night. The description I hear most often: it feels like my feet are on fire, but nothing is touching them. Most patients had blamed long hours standing, summer heat, or old shoes. Several had been applying over-the-counter pain creams for months with no result. When peripheral nerves are damaged by chronically elevated blood sugar, they do not always go quiet. Some begin misfiring, sending heat signals to the brain when no heat source is present. Your brain receives an alarm it cannot locate and cannot silence. The burning is entirely real. Its origin is nerve tissue generating incorrect signals, not external temperature. A peer-reviewed study in Diabetes Care documented that burning foot pain is among the earliest self-reported symptoms in patients later confirmed with type 2 diabetes, frequently appearing 1 to 3 years before formal diagnosis. And here is the part that should stop you. Many of these patients spent that entire window applying creams, buying new shoes, and adjusting how they slept, never knowing they were managing a symptom of something that was quietly progressing the whole time. A 64-year-old retired school teacher told me she had stopped sleeping through the night for 6 months because of the burning in her feet. She had been pressing a cold, damp cloth to her soles each night. Her blood glucose had been uncontrolled for years. Once we addressed the underlying glucose dysregulation, the burning diminished within 8 weeks. The fix: 8 glasses of water daily, without exception. Add fiber to every meal: legumes, vegetables, whole oats. Fiber slows the rate at which sugar enters your bloodstream, which directly reduces the glycemic load your nerves are absorbing every day. Pro tip: avoid alcohol in the evening. Alcohol disrupts peripheral nerve signaling and accelerates nerve damage in anyone carrying elevated blood sugar. The combination compounds the problem faster than most people realize. Reason 7, persistent swelling in the feet and ankles that leaves sock indentations. Some swelling after a full day on your feet is entirely normal. Here is what is not normal: waking up with swollen feet, wearing sock marks that stay visible long after the socks come off, and finding that rest and elevation produce only partial relief day after day. Chronic elevated blood sugar damages the kidney's filtration structures over time. As kidney function declines, the body loses its ability to regulate fluid balance. Excess fluid follows gravity to the lowest point in the body, the feet and ankles. Press your finger into the swollen tissue and hold it for 5 seconds. If the indentation remains when you lift your finger, That is called pitting edema, and it signals that your body's filtration system is under meaningful stress. I want you to hear that again. Press your finger into the tissue on top of your foot and hold it for 5 seconds. If the dent stays, that is not normal swelling. That is your kidney trying to tell you something. A major study published in the American Journal of Kidney Diseases found that lower extremity edema is among the earliest visible indicators of early diabetic kidney involvement, frequently preceding a formal nephropathy diagnosis by 18 months or more. A 68-year-old retired engineer came in after his wife started buying his shoes a full size larger because nothing else fit by mid-afternoon. His kidney function markers were measurably reduced, a direct consequence of years of unaddressed blood sugar elevation. The fix: elevate your feet above the level of your heart for at least 20 minutes each evening. Reduce sodium. Read labels on canned goods, packaged soups, and processed foods, which frequently contain 800 to 1,200 milligrams per serving. Excess sodium signals your kidneys to retain water, which amplifies the swelling significantly. Pro tip: asymmetrical swelling, one ankle notably larger than the other, warrants prompt medical attention. That pattern can indicate a separate vascular concern that requires clinical evaluation beyond what blood sugar management alone addresses. Reason 6: cracked heels that do not respond to topical treatment. Every patient with this tells me the same thing. I have been moisturizing every day for 2 years and nothing helps. They are correct because the problem is not on the surface of the skin. Diabetes damages the autonomic nerves, the branch of your nervous system that governs automatic functions you never consciously control, including the activation of sweat glands in the skin of your feet. When those nerves are impaired, your feet lose the ability to generate moisture from within. No topical lotion replaces that internal moisture production. The skin dries progressively, tightens, and cracks. And here is what those patients were never told. In a foot with compromised circulation, a heel crack is not a cosmetic problem. It is an open entry point for bacterial infection. And an infected wound in poorly vascularized tissue that cannot heal properly because the blood supply to close it has been reduced, is a serious clinical event that can escalate faster than most people expect. The American Podiatric Medical Association identifies chronic treatment-resistant heel cracking as a significant clinical marker of autonomic neuropathy, a condition directly associated with long-term elevated blood sugar in adults over 60. A 73-year-old woman arrived having used prescription-strength heel cream for over a year. The cracks kept returning within days. Her autonomic nerve function was measurably impaired. Addressing the blood sugar, not the heels, was what finally broke that cycle. The fix: moisturize your feet every night before bed. Pure coconut oil or a urea-based heel balm works well. Apply thoroughly to the sole and heel. Never apply moisturizer between the toes. Trapped moisture in that space breeds fungal infection. Hydrate from the inside with 8 glasses of water daily. Pro tip: wear moisture-wicking cotton socks immediately after applying your heel treatment. The occlusion overnight meaningfully accelerates skin repair compared to leaving the foot uncovered. Reason 5: skin discoloration. Around the ankles, patients look down at this and have stopped seeing it long ago. A darkening around the ankle, a deep reddish tint, sometimes a faint bluish cast near the ankle bones. They assume it has always looked that way, sun damage, or just how their skin is. When the small blood vessels in the lower legs narrow and stiffen from sustained glucose damage, oxygenated blood can no longer reach the skin of the ankle in adequate volume. Oxygen-depleted skin changes color. It often becomes thinner, more fragile, and visibly different from the skin on the upper leg. That discoloration is your skin signaling that its blood supply has been reduced, possibly for months or years. A study published in the Journal of the American Academy of Dermatology found that vascular-related skin changes in the lower extremities are detectable, on average, 18 months before a formal diabetes diagnosis is made. 18 months, a year and a half of a signal that was visible to anyone who knew what they were looking at. A 66-year-old man pointed to his ankles during a routine exam and said the darkening had been there for years. He assumed it was from outdoor work. His vascular screening showed early peripheral artery narrowing in both lower legs. The sign had been visible for at least 2 years before anyone thought to investigate it. The fix: 5 minutes of ankle circles, toe raises, and calf raises every morning before you take your first steps. If mobility is limited, elevating your feet while seated produces a substantial portion of the same effect. Pro tip: during your morning movement, flex each foot fully upward and hold for 5 seconds before releasing. This activates the calf muscle pump, one of the most effective mechanisms your body uses to push venous blood back toward the heart from the lower limbs. Reason 4: stabbing or electric pain, attributed to arthritis. This is the sign that men, in particular, mask for years before it is identified correctly, and the masking itself accelerates the damage. Peripheral nerves damaged by chronic glucose elevation do not always go silent. Some become hyperactive, firing at random, generating intense pain signals the brain interprets as stabbing, shooting, or electric shock sensations originating in the foot or traveling through the ankle. These episodes are most frequent at night when competing sensory input drops away. Anti-inflammatory medications like ibuprofen cannot reach the source of this pain because the source is not inflammation. It is nerve dysfunction. And masking a distress signal is the last thing you want to do when the nerve is asking for help. Here's the part of this that I want you to hold on to. Every month that pain is attributed to arthritis and treated with anti-inflammatories is a month of nerve damage that accumulates without intervention. Nerve damage at a certain threshold does not reverse. You are not buying time, you are spending it. A landmark study published in the New England Journal of Medicine found that painful diabetic neuropathy affects approximately 1 in 4 people with diabetes and is consistently misidentified as arthritis, tendinitis, or age-related mechanical pain in its early stages. A 70-year-old retired contractor came in having taken ibuprofen twice daily for 8 months. He was certain the pain was from decades of physical labor. His blood glucose had been elevated for years. We identified the actual mechanism in time, but the nerve damage that accumulated during those 8 months of masking was not reversible. The fix: every morning before you put weight on your feet, 5 minutes of gentle foot and ankle mobility. Flex your feet upward, hold for 5 seconds, release, circle your ankles in both directions, pull your toes back gently toward your shin. Every evening, 5 minutes of gentle sole massage with light circular strokes supports nerve circulation through the night. Pro tip: if this pain is waking you from sleep more than twice per week, bring that specific detail to your physician. Sleep-disrupting neuropathic pain is a clinical threshold that changes the treatment conversation significantly.
Reason 3: persistently cold feet. Regardless of the season, most patients laugh when I raise this. Dr. Reed, I have had cold feet my entire life. I laugh with them. Then I ask the question that shifts the tone. Are your feet cold in July? Your blood vessels carry warmth to your extremities as a byproduct of circulation. When those vessels have narrowed from sustained glucose-related damage, a condition called peripheral artery disease, warm blood cannot reach your feet in sufficient volume, regardless of the temperature around you. The furnace is still running. The pipe is restricted. The room stays cold. The American Heart Association identifies diabetes as the single largest modifiable risk factor for peripheral artery disease, which affects over 8 million Americans. And persistent cold extremities are its most consistent and most frequently overlooked early symptom.
A 72-year-old woman told me she kept a heating pad on her feet year-round and had done so for 3 years. She had attributed it entirely to aging. Her ankle brachial index, a simple, non-invasive measure of blood flow to the lower limbs, was significantly reduced in both legs. This was not age. This was vascular damage that had been progressing in silence, while a heating pad treated the surface and the cause went untouched. The fix: a 30-minute brisk walk every single day, purposeful, at a pace that modestly elevates your heart rate. This forces circulation into the peripheral vasculature, strengthens vessel walls over time, and in early-stage narrowing can produce measurable improvement within weeks. Start tonight. Pro tip: start with 10 minutes if 30 feels out of reach right now. 10 minutes every day outperforms 30 minutes twice a week. Consistency is the variable that matters. Reason 2: hair loss on the lower legs and tops of the feet. This is the sign almost nobody notices on their own. Patients look at their legs every day without registering it. I almost never hear it volunteered because patients rarely see what is not there. Hair follicles require a continuous, adequate supply of oxygenated blood to produce hair. When the small vessels supplying the lower extremities have narrowed significantly from chronic glucose damage, the follicles in those areas begin receiving less than they need. They do not die suddenly. They simply stop producing hair, gradually, quietly, in a pattern that is easy to attribute to age or lifelong genetics. Right now, I want you to do something. Roll up your pants leg. Look at your lower leg, from the knee down. Now compare it to your upper leg. Is the hair thinner below the knee? Is it patchy? Is it largely or fully absent? If the answer is yes, and especially if it is absent on the tops of your feet, that is a clinical finding. That is not aging. That is a measurable reduction in blood supply to the tissue, and it is included in formal diabetic foot examination protocols precisely because it is one of the most reliable markers available. Research published in Diabetes, Obesity, and Metabolism found that hair loss on the lower extremities correlates significantly with peripheral vascular disease severity in patients with type 2 diabetes. A 69-year-old man had completely smooth legs from the knee down. He assumed it was normal aging and had never mentioned it to a physician. His peripheral vascular assessment revealed significant arterial narrowing in both lower limbs, a finding that would otherwise have gone undetected for months, possibly longer. The fix: after this video, look at your lower legs. If you see what I have described, schedule a fasting blood glucose test this week, not this month, this week. A basic glucose panel is approximately $12 and is covered under Medicare for most of you. That $12 can change the entire trajectory of your health. Pro tip: take a photograph of your lower legs today and put it somewhere you will find it in 4 weeks. Progression, or stabilization, is far easier to track with a visual baseline. Reason 1: wounds on the feet that take weeks to close. Stay with me for this one, because this is not the end of a list. This is the reason the list exists. In the United States right now, more than 100,000 amputations are performed every year. Not from accidents, not from trauma, from wounds on the feet that started small, a blister, a scrape, a minor cut, and never healed. Over 100,000 people a year. That is more than 270 per day. And in the vast majority of those cases, the wound began as something the person thought they could manage at home. Here is what is happening inside your body. Chronic elevated blood sugar progressively narrows and stiffens the small blood vessels throughout the body, including the dense capillary network in the feet. Simultaneously, white blood cells, your body's primary infection response, become less mobile and less effective in a high glucose environment. A small wound opens in tissue that no longer has the vascular infrastructure to close it efficiently. Oxygen cannot reach it in adequate volume. Healing cells cannot reach it. And bacteria, which thrive in glucose-rich tissue, move in without resistance. And here is the part that makes this uniquely dangerous. Because nerve damage has often already reduced sensation in these feet, the wound may not hurt. Not noticeably, not enough to alarm. The person changes the bandage, tells themselves it is healing slowly, and waits. Meanwhile, the infection is not waiting. I have sat across from patients who came in with a wound they had been managing at home for 6 weeks. 6 weeks. By the time they arrived, the infection had reached the bone. Osteomyelitis, bone infection, requires weeks of IV antibiotics in the best-case scenario. In a significant number of cases, it requires surgical removal of tissue. In the worst cases, removal of the limb, 6 weeks, with a wound that started as a blister. The Centers for Disease Control reports that diabetic foot ulcers are the leading cause of non-traumatic lower extremity amputation in the United States. In the vast majority of cases, the process began with a small wound that was watched instead of treated. A 67-year-old woman came to me after noticing a blister on her heel that had been there for nearly a month. She had been covering it and changing the dressing every few days. She was not in significant pain, which, as I explained to her, was itself a sign that nerve damage had reduced sensation in that area. The wound had begun showing early signs of infection. We intervened in time. The margin was closer than it should have been. The fix: tonight, not tomorrow, tonight. Sit down and examine both feet carefully. Look at the soles, the heels, and between every single toe. If you find any cut, blister, or broken skin, clean it with mild soap and water, apply an antiseptic, and cover it with a clean bandage. If it has not shown clear improvement in 48 hours, contact your physician. Not next week, 48 hours. Pro tip: reduced nerve sensation in an at-risk foot means wounds can be present for days before producing noticeable discomfort. The habit of daily foot inspection, 30 seconds before bed, is the single highest value preventive habit a person at blood sugar risk can build. Most people have never been told this. Now you have been. Here is a protocol built directly from what the science behind these 9 signs supports. It is designed to be sustainable, affordable, and executable entirely at home. Every morning, 5 minutes of foot and ankle mobility before you stand. Flex, circle, stretch each foot. Follow with a 20 to 30-minute purposeful walk. With your first meal, include a high-fiber food, legumes, oats, or vegetables. Fiber is the most accessible tool available for slowing glucose absorption into the bloodstream. With every meal, choose whole foods over processed ones. Read sodium content on anything that comes in a can, a package, or a jar. Target under 1,500 milligrams of sodium daily. Every evening, inspect both feet, soles, heels, between each toe, 30 seconds. Apply coconut oil or a urea-based balm to the sole and heel, and wear cotton socks to bed if cracking is present. Elevate your feet above heart level for 20 minutes before sleep. 5 minutes of gentle sole massage with circular strokes before bed. Daily, 8 glasses of water. Every day, non-negotiable. Most people address these symptoms individually: lotion for the heels, pain cream for the foot discomfort, compression socks for the swelling. These manage symptoms, not sources. This protocol works because it targets the underlying physiology: blood sugar, circulation, nerve support, and hydration simultaneously. This protocol costs less per week than a single tube of prescription heel cream, and unlike that cream, it is aimed at the actual source of the problem. Reason 9, tingling or numbness that appears without a positional cause. Reason 8, burning in the soles, particularly at night. Reason 7, persistent ankle swelling with sock line indentations. Reason 6, cracked heels that do not respond to topical treatment. Reason 5, skin discoloration around the ankles. Reason 4, stabbing or electric pain attributed to arthritis. Reason 3, cold feet present regardless of the season. Reason 2, hair loss on the lower legs and tops of the feet. Reason 1, wounds that take weeks to close. Each of these alone is a signal worth paying attention to. Together, they create the full picture of what sustained elevated blood sugar does to the body from the ground up, slowly, quietly, and years before a diagnosis arrives. If you recognize yourself anywhere in this list, 1 sign, 2 signs, several, I want you to hear this clearly. You are not too late. The body's capacity to respond when given the right conditions is remarkable, but it cannot respond to a problem that has not been identified. You have identified it now. What you do next is the entire variable. This is not inevitable. This is not simply aging. This is physiology, and physiology can be addressed. Your feet have carried you every day of your adult life, every errand, every reunion, every ordinary Tuesday. They have never asked for much in return, and right now, some of them are asking. In the only language a body knows how to use, quietly, without drama, in ways that are easy to dismiss until they are impossible to ignore. You now know the language. You know what tingling means. You know what a non-healing wound means. You know what cold feet in July means. You know what to look for. Tonight, before you go to bed in 30 seconds with your own eyes, do not wait until a lab test confirms what your body may already be telling you. Sit down tonight, look at your feet, run through what you have learned. Take a photograph of your lower legs. Call your doctor if you see anything on this list. You have the information now. That is the first step. Use it. We are working toward 100,000 subscribers on this channel, not as a milestone for its own sake, but because 100,000 means this reaches a different scale entirely. It means someone watching right now in a rural community with limited access to integrative medicine gets this information. It means someone whose doctor has a 12-minute appointment slot and cannot explain any of what I just explained gets this information. Every subscriber is a direct contribution to that. If this video told you something your doctor has not, that subscription takes 3 seconds and it matters more than you know. Like, press the like button now. It is the most direct way to push this information towards someone who may be spending money on things that cannot work because they have never been told what is actually driving their problem. Comment. Tell me in the comments, which of these 9 signs have you noticed? In yourself or in someone you love? I read every comment and your answer shapes what I cover next. Share. Share this with a partner, a parent, a sibling, a friend. You may never know whose life you change by doing that. The person who most needs to see this is almost certainly not looking for it. You are the way it finds them. I am Dr. Ethan Reed. I will see you in the next video.